Hello everyone. Today we'll learn about core characteristics of incidence in epidemiology. First, do you know what exactly does incidence mean in epidemiology? Incidence is the probability of new disease. That is the absolute risk that a healthy person will develop a specific disease within a certain period of time. It's mainly used for acute conditions, think like flu, food poisoning, or COVID-19 in a short outbreak. Notice that incidence is not influenced by how long the disease lasts. And importantly, incidence is determined through the cohort studies, where we follow a group of healthy people over time and watch who develops the disease. For calculating disease frequency, now let's talk about the formulas. First, incidence rate is equal to number of new cases during a given time period upon population at risk during that period into 1000. We multiply by 1000 to express it as a rate per 1000 people. There are two special types of incidence measures. First is attack rate for small intervals. This is simpler. New cases upon total population into 100. We use this for short and sharp outbreaks. Second is secondary attack rate. This looks at how many exposed susceptible contacts get the disease within the incubation period. It's useful for outbreak in families or classrooms. It is also an index of communicability. A higher secondary attack rate means the disease spreads more easily among close contacts. There is the primary case rule also. In secondary attack rate calculations, remember the primary case, the first person infected is always excluded from both the numerator and denominator. Then next we see that why we measure incidence. Why does incidence matter in public health? There are several key reasons we measure the incidence. First is tracking program efficiency. A decreasing incidence rate is a primary indicator that a health program or preventive measure is working. If we introduce a vaccine or a hygiene campaign and incidence goes down, we know we are on the right track. Second is research into etiology. Incidence is the best measure of disease frequency when studying the causes of illness. And third, indicator of hospital efficacy. Incidence rate tells us how effective hospitals and health programs really are. So we use that. At last, to wrap up all this, incidence measures new cases over time in an at-risk population. It's essential for studying causes, tracking outbreaks, and evaluating the health programs. And remember the formulas. They will appear in your assignments and exams. If this helps you, like, share, and subscribe to my channel.